What happened to the president's promise that his health care overhaul would bend the cost curve down? Here now to discuss are my freedom fighters, Fox business anchor and my colleague Liz Claman, Ellis, Henican, Newsday columnist, and somebody I love to pick on, and Lenore Hawkins, Emeritus Financial Advisor. Lenore, it's a pleasure. Welcome here. Liz Claman, to you first. Is Wall Street surprised at numbers like this? Does Wall Street accept numbers of this magnitude? $1 in $5 ever spent 9 years from now will go to health care.
I don't think Wall Street is surprised by that. Wall Street's more interested in who benefits and how can they get the almighty dollar in.
Does the president like numbers like this, which his own executive branch just released, that even though he promised that Obamacare would solve a great deal of our financial health care related woes, in fact, and I know it's just a prediction and it's 9 years from now, $1 in $5 is going to be spent on health care because of Obamacare?
No. You were right up until the because of Obamacare part.
Right. Does the president like this?
No, of course not. Everybody hates this. It ought to be way cheaper than this. And the frustrating thing, Judge, is that our results aren't particularly good. You stack us up statistically against lots of other nations, and we come up on the short end. So, no. The problem, however, isn't Obamacare, just to say this quickly.
Go ahead.
It's that there's so many others taking money out of the system. The insurance companies, the hospital administrators, the health care organizations.
Lenore, even though I love Ellis, wasn't he wrong when he wanted me to cut off the last few words of that question? Isn't this because of Obamacare that these prices are going up? What other formula are they basing this on?
It's fairly common sense. How do you determine the price of a good? Price is decided by how much it is wanted, demand, and how much is available, supply. The only way to decrease the price of something is either to increase the supply of it relative to demand or decrease the demand relative to supply. Well, Obamacare got this all backward. It increases demand and does nothing for supply, and many argue that it actually harms supply because a lot of medical care providers are going to get out of the market because it's too onerous.
Are you surprised that if the government's going to be paying the health care bills, the government's going to tell you how to take care of yourself? And do you want the government that can't deliver the mail to tell you how to take care of yourself?
No, inevitably someone is not going to tell us how to take care of ourselves, but someone does decide who pays. And today, the insurance companies are deciding. I'm not sure that the government would be any worse. So personally, I would trade my high-priced health insurance for Medicare. Can I please have that?
You would trade your high-priced health insurance for something put together by the government?
Well, it's a lot better than what I'm buying out on the open market for $11.50.
But you have a choice in the open market, right? You could buy something cheaper or more expensive.
Please, find me a good one if you can.